The following is the truMedic story, as told by its executives, the doctors who use it, and the patients that it's helped.
truMedic is a company that designs pain relief products for people to help them with their pain and discomfort and stress and strain. My sister-in-law actually was created the brainchild. She had problems with migraine headaches for years, and through her research she came across a TENS unit that was difficult to use, but it did offer us some relief. So she moved forward to create this company.
When we were first introduced to the truMedic, I really wanted to do testing with my patients. So I got a dozen of them, tried it with all kinds of people with herniated discs, sciatica, cephalgia, headaches, all these kinds of things. The end result that we found out was, because it also has an EMS part of it, which is electrical muscle stimulation, as well as a pulse massage, which other units don't have, as well as a normal TENS, which affects the nerve and how the brain interrupts the brain and creates endorphins. So endorphins are painkillers by themselves. What we found was that the truMedic is really a true, complete process of pain control. This really gives them the ability to help themselves, and that's why I really like it and why I believe this particular unit is significant. And I'm having my athletes and people in chronic as well as acute pain. It isn't just for athletes, by the way. You know, what we do in sports science is really the reverse factor to working with people in rehabilitation all day. This particular unit, the truMedic, has helped me help people decrease the amount of treatment, therefore decrease the amount of cost to them, and at the same time put them in their own self-help control that they can help themselves.
As a former athlete and denying pain, as we all did, I ignored this for a week as best I could, which involved crawling around my place. I was quickly directed to Dr. Perry, and we started some management of the inflammation situation, and that involved the TENS unit shortly thereafter. The TENS unit I was introduced to by Dr. Perry was the truMedic TENS unit, and it's relatively compact, honestly. I actually have it on right now. It's a device about this large, very easy to program, with 2 wires coming out of it simply, with sticky attachments that you just place on your body and create the current in between the 2 pads, the area that you want to address. And there is a sensation of massage, and there is the sense that you would understand that would increase blood flow, which in fact it has. My initial concern very much was atrophy in my leg, which happened really rapidly, and this is something that I felt like I've kind of managed with the use of the TENS, as well as my increased mobility, honestly.
The quality of the truMedic is definitely different than all other TENS units I've ever used. Number one, all the other 10 units, you have to put little batteries in it, and they're always, they're falling apart or they're falling out of the unit. The truMedic's the first TENS type unit, and as I said, it's way beyond a TENS unit to me because it creates muscle stimulation, they can control muscle, it helps brain reflex to the body, so they interrupt that with the endorphins and so forth. But it's like a solid state, I would call it, because the battery is actually part of the unit. This unit really is futuristic. And when I first saw it, I was knocked out. I thought it was great that it was really a solid unit. It's obviously a very professionally made unit. And I loved it that I didn't have to goof around with little batteries, and just like my phone, I can just plug it in and it's recharged. So it makes it very simple for the doctor, it makes it very simple for the patient to use, and patients compliment me all the time when they see it and get one. Many of who have had old type TENS units that for them didn't really work because they didn't really know how to possibly use it, but because we have the different currents with this particular unit, they feel like they're in control, and it works great.
Our philosophy is to keep it as simple as possible. If we can bring the technology to people that need the pain relief without having to have all the hocus pocus about it and the doctor's phraseology that most of us don't relate to, that's what we want to do. So just keep it as simple as possible.
One of the things I really like about the truMedic, it's very simple to use. You just simply turn on button. But what's even more interesting, very different than all the other TENS units that I've used at least, is that it has presettings. As an example, back, shoulder, joint, leg, hand and foot. So I can put the pads on these different parts of the body, and I can control how much time I'm going to use on it. And other TENS units have controls like that. But what they don't have is they don't have a massage reflex. They don't have a beat reflex or a kneading reflex. And when I say reflex, it's because the way the nerves fire and the way the muscles contract, particularly if there's swelling in a joint, particularly on the joint issue, we get athletes all the time with blown up knees from trauma, basketball, everything else, but we get people in here 70, 80 years old with arthritic knees because they have bad feet. So sometimes what we do is you don't even have to treat the knee, you treat the foot, get this proper orthotic, stabilize it with the current, then go treat the knee so you're not just treating a symptom. In sports science, we're not interested in treating symptoms, we want to fix the cause of the problem. Because they can control the current, they can control the preset areas. So once they've gone to presetting, let's hypothetically say a back. So I've got these 4 pads in different locations on the back or down the leg if it's sciatica as an example. And they may do that, it automatically does it for 30 minutes, 40 minutes, however long we want to do it. But then the patient can also go to another cycle where they're controlling more massage because they like the massage feeling, or maybe they like the kneading feeling a little bit better. There's a real psychological plus to that because if the patient feels that something's really helping and they can make it even help longer and better at the intensity they want to feel it, it's a win-win deal. So psychologically you're helping the patient, you're stimulating their endorphin effect, you're moving physiologically blood through the area so there's better circulation, and the patient is very appreciative.
Our focus with truMedic is to create products that are very easy to use. I mean, the technology is wonderful, and the effect it has is incredible. But speaking to the chiropractor that I was dealing with, the main difficulty that he had with his patients is very, very difficult for them to keep in mind what waveform to choose, what setting, what pulse length. It's confusing. I mean, it's just, I'm not inclined to go in that direction, and if I have to remember something like that, I'm more likely to say, I don't want to do anything wrong, I don't want to get hurt. But what we've developed is so simple to use because we're using common phraseology, shoulder, hand, foot. You just press that button and you get the waveform that's appropriate for that area of the body. The feedback I get from the people, the customers that I talk to, it's astounding. It really is something that's so simple and so readily available, can change lives as it has.
I've been using the truMedic for a long time now, and because it's benefited my patients, it's encouraged me as a practitioner to keep using it with more and different types of conditions. So I really don't use it just with athletes. I use it for people, a lot of my patients are in their 70s, 80s, and even 90s, a few people over 100 years old. And these are a lot of patients who don't want to take medication. So this has really become an alternative for them to have a way to help themselves. So one of the greatest benefits, at least in my practice, is that if I can help a patient learn to help themselves and they don't need me, they don't need as much treatment, they save the cost, they save the time, this has definitely been a definite tool that they can learn to help themselves with.
It's very exciting. We have a lot of products on the verge of coming out. The next one that's coming up is a mini TENS unit. It works without wires. It's like a little scarab. It has a double pad on the front, and in one movement you take the plastic off and place it where the pain is, press the button, and you bring the intensity up or down as you choose to, and you're done. There's a site that they can visit. That's www.painreliefebook.com. And in there is a wealth of information about how the technology works, why it works, how it makes you feel, and things that you can do to improve your situation without having to go toward drugs or other alternatives.